Welcome to the High Risk Pregnancy Training Academy, where ANMs, medical officers, and specialists come together to learn about high-risk pregnancy conditions, share experiences, and work together to ensure the best health outcomes for mothers and babies. Today we will learn about the components of a quality antenatal checkup that are essential to the identification and treatment of these high-risk conditions. First, let's meet our expert trainers.
Hello everyone, I am Dr. Karishma Tharyani, and today I am talking to Dr. Tara, who is a senior specialist in the field of maternal and fetal health practicing in New Delhi. In the course of this video, we shall be talking about the role that quality antenatal checkups play in providing the best possible care for women suffering from high-risk pregnancy conditions. So thank you for joining us, Dr. Tara. Ma'am, can you please tell us what are high-risk pregnancy conditions and what can be done to provide these women with the best possible outcomes?
Yeah, thank you, Dr. Karishma. So the high-risk conditions in pregnancy are any medical disorders which complicate the pregnancy. So diseases like diabetes, anemia, hypertensive disorders of pregnancy, which is a very common thing, certain medical disorders like epilepsy and autoimmune disorders can also complicate the pregnancy. So to be able to identify these medical disorders or the disorders that can come even because of the pregnancy is what our main aim should be. So the early identification can only happen when a detailed history taking is taken. And it is very, very important that the history taking has to be absolutely according to the protocol. Thereafter, being able to, identify those women that need to go to the tertiary healthcare centers and not just come when there is an emergency, because then we've lost the right time to be able to manage these pregnancies well. On the other side, we also have to ensure that women don't land up in the tertiary care centers and overburden these centers. So a good mixture of quality antenatal checkup is needed by the ANMs and the medical officers to be able to refer in the right time, at the right time, in the right way to the tertiary healthcare centers.
Ma'am, please tell us, what is thorough ANC?
So the most important criteria or the basics of the antenatal care is to ensure that the women who comes to you, the pregnant lady who's coming to you, actually trusts you. And this trust building has to start from the beginning when the patient walks in. And it is important that the lady can share with you all the problems that she is encountering while being pregnant, not just her own medical condition, but also her family conditions. So this is the most important thing, because she's kind of giving her entire pregnancy, her baby's welfare into your hands.
Sure, ma'am, and you've made such an important point here. So many times in our busy practices, we become judgmental towards the history that the patient shares with us.
Right.
It is very important to be kind and respectful towards the patient if we want her to give us the details about her personal...
Right. So important about...
Exactly.
Yeah, very, very important point, Dr. Karishma. And once we have earned that trust, we've just got to put it into our documents, because the documentation is very important. And that begins with the name of the patient, the age, where the contact details, including the mobile number and the address, the husband's details, the occupation of the husband, and then start with the basic antenatal checkups that is needed in the chart, the antenatal chart that has been provided to the patient.
Very true, ma'am. Documentation is of extreme importance.
Right.
Ma'am, now let's come to what are the components of a good antenatal history?
So the detailed antenatal history comprises of 5 important history taking, and it's easy to remember like the 5 fingers of the hand, which makes it the first one being the chief complaints, which is what the patient is coming with. For example, few patients have nausea, vomiting, constipation. These are very common problems. Some women can have dizziness as well, or fever. So this is the chief complaints we should start off with. Then it comes to the menstrual history, and it is very important to understand that, because the last menstrual period, the first day of the last menstrual period, is very important. It's important to understand how regular were the periods and whether the periods were heavy. That's the second finger. The third one comes to any medical disorders or problems that the patient has had, any surgeries that she's had, which again would classify them into low risk and high risk, and then triage the patients accordingly. The fourth will be the past obstetrical history as to how long the patient has been married, how many children does the lady have, and how was the delivery conducted, and did they have any problems, or did she have any problems in the antenatal care, and are the babies okay? So that's the fourth one. And fifth and the final one is the current obstetric history, where you just ask in general about the problems that is, or whatever she's feeling in this pregnancy. So this 5 components have to be first asked and then documented in details in the antenatal card that has been provided.
Exactly. Now let us move to antenatal examination. Antenatal examination basically comprises of general physical examination, breast examination, and abdominal examination. It can be done by the ANM and medical officers also. So before anybody starts antenatal examination, it is very important to remember the 3 basic things. First and foremost, take a verbal consent. Inform the woman the process of examination so that she is not scared and she is comfortable while you're examining her. Ensure that the examination is taking place in a secluded room or a well-curtained area which is close to the bathroom. Whatever you need for examination, very basic things are required for antenatal examination, but whatever equipment is required, ensure that the equipment is arranged beforehand. What equipment is required? Very minimum things like a BP apparatus, stethoscope, a few clean sheets, a percussion hammer, and an inch tape, and a few cotton swabs in an antiseptic solution. Once all these things are ready, then you're all set for the antenatal examination. Dr. Tara, can you tell us in detail about the components of antenatal examination?
So for the ANMs and the medical officer, as you mentioned, there are 3 important ones. One, just inspect the lady from head to the toe, understanding and realizing what problems the lady can have. So this can begin with looking at the eyes, looking for pallor, looking for icterus, which is to look for jaundice. Then the mouth, the oral mucosa, again suggesting of anemia, any sores for vitamin deficiencies. Look at the nails, clubbing, choleonychia, all reflect on different aspects of medical problems that can be there. Then while you go to the toes, you look at the pedal edema, and that's the first part of the examination, which is a general examination. The second part is the breast examination. The examination is very important because it is important to understand that the nipple is not inverted. So you check for the inversion of the nipple, because that can help the lady in breastfeeding later on if you can start working on it right from the start. You look for any soreness, any kind of flakes over the nipples, because that also helps further later on in breastfeeding. And also look for the lumps to make sure the breast is healthy. The third and the most important examination is the abdominal palpation, where you look in details as to how far has the pregnancy gone. And this can easily be done by putting a hand on and using an inchy tape and what is called as a symphyso-fundal height, measuring that. So that's the first thing. Then with different grips, the important thing is to realize where the baby is lying. What is the position of the baby? It's not head down, it's head down and not bottoms down, which is also very important to know. And then once we feel the back of the baby, after the grips that will be taught later on, the ANM or the medical officer should look at the fetal heart. So these are the few examination points in the antenatal. To begin with, it can start with the inspection and then the palpation, and that completes the entire examination. Once she's referred to a specialist, then the fourth part comes, which is examination internally, should there be a need for it. And by internal examination, I mean using a speculum, just because it can tell a lot about any discharge, any leakage, any bleeding points, any bleeding areas, or even diagnosing any bleeding which is coming through the cervix. So speculum can be done, but ideally it should be done by a practitioner who knows how to do it.
As a clinician, I feel that general physical examination is the most important part of any examination. But somehow in an antenatal patient, it is often missed or ignored. Dr. Tara, would you like to tell our audience about the general physical examination in depth?
Yes. So the general physical examination starts from weight, taking weight and the height of the patient so that a BMI is taken out. Recording a BMI is very important. It could be done by the formula, kg by the weight by the height per square meters, or you can actually put it in the BMI calculator and it's very easy. And why it is important is because it gives us another risk factor if the patient or the pregnant woman is less than 18.5 or more than 30. 18.5 to 25, it's normal, but anything above 25 becomes overweight, but more than 30 is obese, and less than 18.5 makes it underweight. So very important. So underweight pregnant women or overweight or obese pregnant women have their own set of complications that goes on in the pregnancy. So usually the weight gain in the entire pregnancy, we say about 11 kilos. So anything between 9 to 11 kilos is normal. Especially in obese women, it should not go, anything more than 9 kgs. If you calculate it per month wise in the second and third trimester, it comes to about 2 kilograms per month. So any women, because the weight should be taken every time the patient walks in for the antenatal checkup, if the ANM or the medical officer understands that the weight gain is 1 kilogram per month or it's more than 3 kilograms per month. So these are two extreme factors which needs to be noted and documented and referred accordingly.
Dr. Tara, could you please elaborate on vitals?
Of course, vitals are again a very important part of the detailed examination. It includes the pulse rate, the blood pressure, temperature, the pulse oximetry if there is actually a need for it.
And the respiratory rate.
So pulse rate should not be more than 100 or so. BP should be between 120 to 80, and temperature not more than 98.6 degrees Fahrenheit. 100 is the figure that you look for. Similarly, pulse oximetry not less than 93%. So these are the few parameters that you've got to look into and record.
It is very important to remember the normal range of the vital parameters, especially with the ongoing pandemic. Every ANM medical officer should be very thorough with these normal values so that they can easily pick up whenever they find any abnormality in the measurement of the vitals.
So triaging the patients and understanding the low risk and the high risk and then referring accordingly early on is the mantra here.
Thank you, Dr. Tara, for being a part of this training. So it is very important for all of us to remember that a thorough history, thorough examination, counseling the woman, and focusing on building the pregnant woman's trust are the 4 most essential components of quality antenatal checkup.
We have reached the end of our training on the protocol for quality antenatal checkups. Remember to go through the protocol for quality antenatal checkups for more details.